Hi, my name is Lena. I am 31 years old and I've struggled with acne all of my life. I started Accutane when I was about 13 years old and just had tried home remedies and previous dermatologists up through my life now. And today I'm really excited to be doing the PIX treatment by ROHRER. And it's gonna be the microneedling plus RF treatment with the ablative laser. That way it'll help me resurface my skin. Following that, I'm gonna be using Dr. Emer's entire skincare line to make sure that I heal in all the right ways, that I build my collagen back, lighten my scars, and really build the protection there. So I'm very excited to try it today and see where my next step goes.
Hey guys, it's Dr. Jason Emer, board certified dermatologist in both Los Angeles and New York and Miami. I'm super excited to talk about this patient today. Her name's Lena. So my patient today is going to undergo a combination treatment. And for those who don't know me, back in 2014 when I started this whole revolution of combination treatments, I was literally booed off the stage of a large dermatological conference when I combined a laser and a microneedle. And it's so funny that today we have a new device called PIX that combines needling and laser, exactly what I had been booed off the stage for almost 10 years ago. And this goes to show the evolution of aesthetics, and what we do in treatment really can have a huge impact on a patient's self-esteem and their overall look.
Okay, so right now we're doing nerve blocks, and nerve blocks are when we do injectable medications throughout the face to make the treatment more comfortable. So of course we are going to do, or we have already done, our topical numbing, and that will last anywhere between 30 minutes to an hour depending on the treatment we do. But with some of our treatments that are very spicy, we like to do nerve blocks as well to make the treatment a little bit more tolerable. That involves some injectables throughout the forehead, and then also we're going to do inside the mouth like a nerve block, so it might be a little bit difficult to talk.
Hey guys, we're now doing our combination therapy for our patient with severe acne and acne scarring, pigmentation, and just overall anti-aging. We want to use microneedles with radiofrequency, and these are going to really penetrate the skin, not only to break apart the scars and build collagen, but for tightening. We really want to get a nice degree of tightening for her long term. This is also anti-aging. So for those that are looking for improvement in the overall look of their skin and quality, this is going to shrink the pores, it's going to tighten the skin, improve fine wrinkles, but when used in specific settings, we can get a huge improvement in texture, which is what our focus is for today. All right, we're now going to start with our erbium, PIX erbium, you guys. And I want to show you guys, this is a fractional erbium. So when we do this pass, take a look. You can see there's all these little holes here depending on the depth that we've set. And they're only taking up about 35% of the surface. So that means that what I'm going to want to do over this scarring area that I've marked is probably go a little bit stronger. But this is going to, or a little bit more in density by doing multiple passes. This is going to give her a nice resurfacing. The great thing about this device is, you know why it's so loud? Because it's snapping the skin. It's literally taking pieces of the skin and snapping them out, because this is a cool laser. This delivers less energy so that there's less risk of pigmentation on the patient, but she's still able to get a really good resurfacing result. So we're not only going to improve her in terms of quality of her skin, but also her scarring. So you guys can see erbium can literally break through right through a stick. It's delivering not as much energy, it's absorbing the water in the surface, and it's just eating away. So if you take a look, this is fully ablative. Wherever I point, it's just gonna eat away at that tissue. All right, we're now working on the fully ablative resurfacing here after we've already done her fractional. This is gonna take off the upper surface, but with the right skincare, it's gonna do a huge improvement in texture and tone, and it's gonna allow her to get a much bigger improvement in the acne and acne scarring that she has in this area. Erbium's a little bit safer than CO2. It's more of a cool laser because it does attract the highest amount of water, which is less heat dispersion, less risk of pigmentation, and safer on almost all skin types. After you do an aggressive laser, you guys, you have to heal properly. And what has changed over the years is what we put on immediately and what do we put out in the next few minutes and hours. We're gonna put some PRP on, we're gonna add in stem cells, exosomes, and we're gonna use an immediate treatment called glacial to help her heal. But first, we gotta get that into the skin. If somebody has pigmentation, or they want to heal at the same time, we now have the new Anti-Age MDX brightening exosomes, you guys. This is incredible. Not only are they going to deliver exosomes, they have tranexamic acid in it that's going to help decrease inflammation and improve pigmentation. Rather than just cooling the skin, it's actually putting in ingredients that are actively helping it heal. Licorice root, peptides, tea tree oil to help any outbreaks, peppermint for cooling, and a biocellulose matrix of botanicals, you guys.
Hey guys, we are doing our most favorite after laser treatment. We are doing our glacial glide treatment. So this is 10 minutes of cold. This is really going to help with her inflammation, her redness, speed up her healing.
Amazing. The staff was incredible and made me feel so comfortable and safe and minimized any pain that could have happened. When I get home, I'm going to be applying my PRP 4 hours after, and then I'm going to be following the skincare process that the estheticians have given me. It's extremely comprehensive. They walked me through the entire process, as well as given me a take-home packet that tells me exactly step by step what to do. So I have a process that the estheticians have done a great job explaining me on what to do, and I'm going to take you through it. And now I'm going to be putting on the illuminating mask that Dr. Emer made from Emer Skin. So this I'm going to be putting on. It's going to help brighten everything, heal, even out my pigments, and I will sleep with this for 8 hours, get my beauty sleep.
Hey everyone, Jonathan here, esthetician with Dr. Emer. Today we are doing a Emer Skin oxygen facial with our glacial glide right after, combining it with the Emer Skin hydration mask. Our patient just finished doing some laser yesterday, so right now we want to make sure that we clean off the skin, get rid of some of that illuminating mask that we applied on last night. So pretty much the first step is to do a vinegar soak, which we're using 1 tablespoon of white vinegar to 1 cup of cool water. So we're going to go ahead and apply this over the skin. So right now with the vinegar soak, so you guys want to make sure that you guys saturate the skin with the vinegar soak. It's really important that you guys leave it onto the skin for about 5 to 10 minutes. All right guys, so right now we're getting ready to do our oxygen facial. So in here we're mixing in a blend of vitamins and minerals that are pretty much going to go onto the skin to pretty much help hydrate and moisturize the skin. All right everyone, so right now we just finished doing the Emer Skin oxygen facial. So we're going to be combining the Emer Skin intensive hydration mask with our glacial glide. So this is going to be very cooling for the skin, but it's also going to help reduce swelling and along with increasing moisture and hydration within the face.
I am really excited to see my results tomorrow. I'll continue my very, very thorough skincare routine to make sure that I heal very speedily and can get my skin back looking better than ever. So I'm really excited to continue to see my results. I'm super happy and proud of where they're at already. And I just can't tell you how happy I am to do a laser like this in Dr. Emer's office where they're explaining everything. I'm super educated. They do an amazing job, but also all of the products after for the aftercare really help me regenerate instead of other places that I've been in the past. So I'm very excited to see my results, and I'll see you for day 3. Okay, so I am now going to put on my AOXC vitamin C. Oh my god, I can't believe it's day 3. Okay, so AOXC, then I go in with my botanical serum. My botanical serum is drying. Want to put on my Hyla B. Again, the hyaluronic acid needs to cling to the water molecules. So I'm doing 5 to 8 drops of this one. Then I'm going to go in with my hydration mask, 10 minutes.